Hi, I'm Colin Hung with Healthcare IT Today, and I'm with Dr. Yan from Chief Medical Officer of Philips. Welcome to the program.
Thank you for having me.
So we're here at Collision, which is an innovation conference here in Toronto. Thank you for coming to my home city. You recently gave a speech at the end of 2021 where you spoke about how COVID-19 has really accelerated the pace of innovation and health, especially in healthcare. Now that we're sort of getting towards the end of the pandemic, do you see any way that we can sustain this level of innovation?
I definitely think that we can sustain what we started during COVID. And if I can highlight a few things, there was already a drive towards digitalization in healthcare. There was a tendency to do more of the care at home with making use of digital technology for telehealth and virtual care. It was happening before COVID, but it was going at a slow pace because it had to counter the usual way of delivering care to patients face-to-face in the hospital, in the outpatient clinic. Now, because of COVID, when patients could not come to the hospital anymore, the need and to use these digital tools to give and continue giving care to these patients was of paramount importance. So everything that had to do with virtual care, with telehealth, got accelerated. And I would like to refer to a report of Frost and Sullivan, who made the forecast that the market for telehealth would increase 7 times because of this.
Because of COVID.
Now, you saw that not only the providers of care went into telehealth and went into virtual care, especially to take care of their chronic patients that could not come into the hospital anymore, but that was followed very fast by reimbursement changes.
Right.
And there is where we have to look into the future. I think that doctors, hospitals, hospital administrators are now ready to keep doing what they did during COVID, at least in part, making telehealth, virtual care part of their care delivery system. I also think that patients will adopt it more readily now because they got used to it out of need. And now the proof of the pudding will be in the eating, in the fact, are the payers going to continue to reimburse virtual care and telehealth in the same way as they did during COVID? If that is the case, I think we will not lose that acceleration. It will plateau a little bit, but we will continue using telehealth more than we did before.
I totally agree with you. I think very key will be whether or not the funding for telehealth remains at the same reimbursement level as an in-person visit. Because I think if not, then I think people go where the money is, and you'll see a decline in telehealth, except in those cases where there's no other way to provide that care or the patient's just not able to come in. I hope that we'll continue to see that. But is there other levels of other areas of innovation that you saw through the pandemic that also accelerated? I mean, telehealth was obviously one that came through, and you mentioned care at home and the whole. I look at it as sort of the remote patient monitoring movement. Did you see a surge in innovation there, and how can we sustain it over there?
Absolutely. What we also saw, and we published our last edition, the 7th edition of the Future Health Index last week. And we interviewed 3,000 decision makers in healthcare, leaders in healthcare, CEOs, CIOs, heads of department. And we asked them what keeps them awake at night. And besides data and AI, which we can maybe talk about later, 25% of them realized during COVID that they had a social responsibility. That was only 12% last year. So the fact that probably these decision makers in healthcare realized that there is so much social responsibility coming their side because of the fact that they have to keep taking care of their chronic disease patients, even if they cannot come in the hospital, was something that was very surprising in the positive way, so to speak. And then because they started to use telehealth more, they got more excited about it. And I give you an example from Australia. In Australia, we work together as Philips as a company with the hospital, West Moreton hospitals. And we provided them with a complete hospital-to-home solution with iPads, with wearables, with connectivity, with making it possible to talk via remotely with your doctor. And what we saw is that we could reduce, or the hospital could reduce, the number of emergency room visits by 50%. They could reduce the hospitalization with 23%. And most importantly, maybe from the payer side, by using this new way of delivering care, they could save 1,000 Australian dollars per month.
Wow.
For every patient that was included in the program.
Amazing, amazing. Just on the note of that study that you did, or that report that came out, was there anything that was surprising in that report that surprised you? A pleasant surprise?
What surprised me was the appetite these decision makers were developing for artificial intelligence. We ask this question every year over the last 3 to 4 years. And yes, they were passionate about it. Yes, they saw the advantage of artificial intelligence in their day-to-day work, but they focused especially in the previous years on workflow improvements. For example, expediting the flow of patients through the radiology department by automatic reporting, automatic scanning, automatic scheduling of patients, or in the emergency room, same thing, or to control for prospectively for non-shows in the outpatient visit based on data analytics of their population, workflow improvements. Now the appetite increased dramatically for clinical decision support. And that is something that we did not see before, that these decision makers, they say, listen, we are going to invest from now onwards. We invested in telehealth during COVID, but from now onwards we are going to invest in AI for clinical decision support because we believe that it will help us, our doctors and our nurses, to do a better job, especially against the backdrop of the increased burnout that we have seen over the last years, which was also accelerated during COVID.
So AI is now seen as an assistant rather than as the enemy. I think in the past, people looked at AI for clinical decision support as saying, no, I don't want that because I don't want it to take away my decision making, my job. But with the decrease in staffing and the workforce in healthcare, I can see that maybe AI is now looked at, well, this is a way to relieve stress and eliminate some overhead in terms of just helping, because there's just not enough people around.
There's not enough people, and the people that are there are burdened by a lot of thought processes that they have to go through to make the right decision for their patients. And it is right that the appetite is there, the passion is there to go for it, but we have a lot of work to do. There is still fear for cybersecurity, fear for privacy. The data are still very much siloed and not connected. In a previous Future Health Index report, we asked young healthcare professionals on how they looked at data and how they can use these large amount of data to provide better care. And they all say, listen, we believe in it. 75% really realized that if we would be able to integrate all these different data sources, we would come to a better and faster decision with less personal input of people, the human factor. But then data are siloed, they are not connected, there is no interoperability. 60% of these young people said, I cannot use the data, they are not actionable for me. So that we feel as a company, and I think the whole medtech industry feels that we really have to do a better job to make it easier for doctors and nurses and hospital administrators to work their data, to manage their data on platforms and ecosystems, all interconnected, while at the same time preserving cybersecurity.
Philips obviously is a global company, works with a lot of healthcare organizations around the world. As you look across the globe, are you seeing any trends, anything interesting where people are investing more of their time and energy? We mentioned AI, we mentioned workflow before, but are you seeing anything on the horizon that maybe we should be aware of?
I think so. The two things I see on the horizon relate back to what we discussed previously. It is data. Putting data to work is getting tremendous attention now, and there is a lot of push doing this, and also a lot of enthusiasm to take away all the hurdles. And the second thing is the social responsibility. What you see increasingly in hospital administrators is that they feel the responsibility for the population they serve. They are less likely to just accept patients when they come through the front door of their hospitals. They want to reach out and take care of more preventive medicine, delivering care at home, delivering care in outpatient facilities, very close to the house. And there is another example that I would like to talk about, is the Atlas project we are doing together with the VA. A lot of the veterans are in very remote areas in the US and cannot access healthcare as easily as they should. So Atlas is accessing telehealth through local area systems or local area sections. So because they are living in areas where the bandwidth and the internet connections and the internet possibilities are not so good. So we created together with them sort of local hubs from where they have easier access to telehealth offerings. So
right.
And so that is what healthcare leaders are looking at. First, how do I go about all these data and how do I make them actionable for my doctors? Maybe I can help them in their work so that they don't get dissatisfied and burnt out and have a better human experience. And second, how do I address my patient population better by reaching out to them, going out until in their homes and somewhere in between before they come into my big healthcare hospital facility.
Let's turn our attention to Philips for a moment. Where are you making investments and what's on the horizon for Philips?
We are deeply invested in digitalization, and that is both making use of digital solutions, artificial intelligence, data management, data security within the hospital. For example, working with radiology departments to expedite their workflow, to make it easier for radiologists to make the right diagnosis at the right time and in a very confident way. And we bring digital tools to the market that can help doctors do that. And we hope thereby reducing the burnout risk in these doctors that have to go through a lot of data with less people, basically. And the second thing that we are investing in very heavily is remote care, telehealth, and everything that goes with it. Monitoring devices at home, connecting seamlessly with monitoring in the hospital, monitoring more easily and more continuously in step-down units from the intensive care so that people do not get readmitted, working with geographies, with governments, with hospitals to help them take that social responsibility, reach out to patients and providing them with tools to take care of their chronic patients at home. These two things are really in the midst of Philips' strategy. And we want to do that in end-to-end solutions. We don't believe that individual point solutions will work. We will look for partnerships, big partnerships, smaller partnerships, where a hospital system wants, or a government or a municipality wants to work with us end to end to bring care better and easier to the patient. And we always keep in mind the quadruple aim paradigm. With everything we do, with all the solutions that we want to bring to the market, we want to improve patient outcomes and outcomes on the population level. We want to improve the experience of patients when they have to engage with the healthcare system.
Sure.
We want to improve the experience of doctors in order to curtail a little bit this burnout trend. And in the end, that should lead to lower costs, as with the Westmoreland Hospital, where we could, by providing this home telehealth care, we could reduce the cost by 1,000 Australian dollars a month for every patient.
It's encouraging that you're looking to help address the access issue without adding more burden to the physicians and the clinicians, because one cannot, as we found during COVID, one cannot happen at the expense of the others. We have to move them in lockstep. So it's encouraging that you're looking at solutions that not only will improve access for those in remote areas and for those that don't have ready access to care, but also to make sure that whoever's on the other side of that delivering the care also is not overburdened. Final question for you. What are you personally most excited about as you look across healthcare IT for the next 6 months? Is there anything that's got any technology, any digital health solution that's kind of got you excited?
Now, I think maybe not a point solution. There is so much exciting things when you are going to conferences and look at all these startups. They have really, really cool things. And I could get excited about all of them. But what I get excited about is when you look at what is happening now in the transformation of care, with all the challenges that we have, the costs that are too high, the quality that is not where it should be, the patient experience, just go to a hospital if you have to, it's a burden often. The complications that are occurring there, the high costs. I am really, really enthusiastic about how digital, especially how artificial intelligence enabled data processing, that is going to be the future. To work in a platform, to work in a SaaS system, software as a service, to help doctors, to help patients, that is what I'm passionate about. And it has different, some of these point solutions can be integrated there, but it needs to be an end-to-end solution. That when I develop a chronic disease, if I develop asthma or even cancer or cardiac heart failure, that I can stay as close to my home as possible. I am monitored remotely. I don't even see it. When something happens, my doctor will be alerted automatically. I will be called into the hospital. I don't have to go there and sit in waiting areas for half a day. I can live my life because digitalization has helped my doctors monitor me continuously and be alerted if something is wrong with me. That is what I'm passionate about.
That's amazing. That's amazing. Dr. Jan, thank you so much for sharing the information you shared with us today, and thank you for being on our program.
Thank you very much for having me once again.
This has been Colin Hung for Healthcare IT Today. Thanks for watching.